Very often, people wonder whether extremes of ages could be potential organ donors or not. While there is no ambiguity between the people who are in their teens, who are in their early 50s or early 60s, the question starts to come once they cross the seventh decade of life, or they are in the first decade of life, especially if they are less than 1 year old. So let me clear you one thing. Scientifically, there is absolutely no bar as far as age is concerned to be a potential organ donor. A 1 day old child or a 100-year-old person, both of them could be potential organ donors. We should not be judgmental as family members, as doctors treating these patients. We should be very, very transparent. Go ahead and declare these patients as brain death, or discuss these patients with the organ donation agency like NOTO or ZTCC as a potential organ donor. And more often than not, they would say that go ahead with the declaration of brainstem death, and then let the organ-specific committees decide the potential of utilizing a particular organ. So, while heart and lungs may be difficult as the age grows up, liver and kidneys are very often transplanted, even in elderly people. And young people who are young children, who are less than even 1 month old or 1 year old, can donate all their organs just like an adult to a pediatric child. And then there would be a child who would live a normal life after that. So don't be, thinking about whether you are a potential donor or not. Let that decision come from the experts, which is the doctors. Let us basically be following one simple principle, that every person who is a potential organ donor should be referred to the organ donation agency for a potential for organ donation, and a consent to be taken from the family. And if the family says yes, let the experts decide whether a particular organ can be utilized or not. And trust me, something or other would come out good of that process. I have yet to come across an organ donor who has not donated anything. To the least, eyes and skin can be donated. That still becomes a very, very big donation. So let's not be judgmental about it. Let's have a transparency on the process, that we would refer ourselves to an organ donation agency to be decided whether the organ donation can go ahead or not, for which organs it should go ahead and not. And let us not become our own judges by saying that just because the age is an extreme, we won't do it. Thank you.